Yes.
Okay. Thanks everyone, and I'm glad to be a part of this, and definitely love talking about the Chattanooga Tumor Clinic. Our clinic is a nonprofit 503c, and we accept patients who are diagnosed with cancer that are undergoing treatment. And I'm sorry, my thing's going faster than it needs to. But we undergoing treatment that are 200% or below the federal poverty level. And this is our mission. So we are literally dedicated for those who are underserved adults and their families. And besides financial assistance and education and support, we hope to stabilize people's life and for them to live have strength and resilience, especially in their time of need. We've actually been around for 80 years. We were the best kept secret at our Langer facility. We are now housed at Memorial's Plaza C, but in a few years from now, we're actually going to be off campus because unfortunately the community thinks that once you are in a hospital that you only serve those people. So we literally serve Hamilton County, the surrounding counties in Northwest Georgia. We, like I said, serve the uninsured, the underinsured, and we also serve undocumented. And I'm trying to figure out how to stop my thing from going ahead of me. Maybe.
Oh, Tina, I think you might need to hit
Go to the slideshow.
Yeah, the slideshow. Right
At
now
the
we
top.
just
Of your PowerPoint screen.
So hit.
Yeah,
What?
go to slideshow.
Oh, in the slideshow. And then how do I get it to where you guys don't see all this lovely stuff on the side?
Yeah, if you go across your top there where it has like the file, home, insert, go to slideshow. Just keep
Right.
it and click on that. And then from beginning. So if you go down to that bottom toolbar and then from beginning, there you go. And click on that one and it
And
should.
I'm going to skip through this. Well, I'm having technical difficulties. Let me just, there we go. Let me just keep on cruising through here. I'll use my laptop and I'm not facing you guys, so I'm sorry. But what I was saying is that we also serve the undocumented and partner with our local hospitals and other nonprofit and for-profit organizations in our community. So a couple of our partnerships, we also have a satellite office at Metropolitan Ministries, but we partner with Welcome Home, Project Access, and Volunteers in Medicine, along with dental groups, surgical groups, imaging, our local churches, and there's actually too many to list because we are all about collaborating with the community and providing a need for our underserved cancer patients. So this kind of shows what we've done the last 3 years. I joined Chattanooga Tumor Clinic in 2019. The goal was to develop programs and to change our mission slightly from a tumor clinic that took care of the uninsured in our office to actually moving those back to the facilities and doing other types of partnerships and wraparound services. So in 2019, pre-COVID, we had seen 284 new patients and helped over 1,000 cancer patients and their family. And then of course we saw a dip in 2020 due to COVID. Although we saw a dip in the amount of people referred and services, the quality of the services changed. So, and I'll go into that more in detail as we go along on the other slides. This past year, we helped 263 new patients were referred to us, and it's not cooperating with me still. But, and then we had a little over 1,700 that cancer patients and their families that we have. So although COVID came about, we did not close our office. We just changed the way we took care of patients and screening and so forth. And then of course, as we continue to watch our community and so forth, we brought our clients in, moved from basically telephone and telehelp to in-service care and out-service care. So we offer both programs. In 2021, we actually paid out a little over $500,000 in patient services. So some of the services that we provide, one of the programs that helped to build here in our Chattanooga Tumor Clinic is financial navigation services. What that entails is that we actually help patients, if they're uninsured, find them a payer source. We help to optimize insurance. We also help to find foundation and other ways that could pay for services, and others in the community that will help services that we may not provide. Some of the things that we provide is prescription assistance for medications. However, we do not pay for chemo or the new immunotherapy drugs for our cancer patients because those drugs are highly expensive, and we would actually deplete our funds if we helped with those services. But we have a lot of great programs in our community. Erlanger has the 340B program, and of course, pharmaceuticals partner with your oncology groups to offer those meds for free for uninsured. We also, like I said, do surgical, we pay for surgical services for some patients. We also have a new program that we built in 2020 called CPC Beyond Medications, which is, we partnered with MetMen on this. This program actually helps to find a lot of our patients, amazingly, some of them do not have phones, or they have phones and they pay for minutes. So you can't get a hold of a patient if their minutes are actually ran out. So we started paying for their minutes. We also, if they're behind on their rent or they're going to be late with their rent, we work to pay these fees and some utility fees, because the last thing you need is to try to find housing for someone during their cancer treatment. They become homeless. And as many of you know, working in this community, you have a list for a waiting list for housing, and it's expensive to stay in hotels and so forth. We also partner with dental services to have it pay for extractions and dentures for our head and neck patients. We offer overnight lodging if they have to be in town for more than 2 days. We also, pay for staging, which is what happens when a patient is diagnosed with cancer. They have to have imaging and so forth. So we've partnered with Prime Imaging on that. And then we also provide gas cards because transportation is a big issue and gas is expensive. We pay for bus passes and so forth, and taxi. And then of course we've got nutritional services where we have nutritional supplements here. And then we partner with food banks and so forth to help make sure our patients have those needs met. So these are a lot of the services and the wraparound services that we provide. One of the things that you'll hear people in the cancer community talk about, providers and so forth, is financial toxicity. And so when you're talking about cancer, we relate everything to adverse events. And a lot of that has to do with toxicity. So what financial toxicity is basically describes the objective financial burden that these patients face and their distress that they are experiencing due to their cost. So, and this term was actually brought about by Dr. Zafar in 2013. So a lot of this financial toxicity is because of lack of insurance or the type of insurance. You know, just because you have TennCare or Georgia Medicaid does not mean your financial burden has stopped. It is still, unfortunately, you're still in the poverty level. That's the reason you qualify for those services. Also, insurance plans have high cost sharing, and you talk about high deductibles, co-pays, and even some insurances, including some Medicare Advantage plans, patients are responsible for 50% of their radiation treatments. And then you talk about, let's just look at Medicare in general. When you look at Advantage plans, some of the high deductibles are literally $6,700 to $7,200 a year. So there's ways to get around those high deductibles that financial navigation helps with, especially when you're talking about in January when all their deductibles start over, and you want to basically hit that deductible, let's say with their high costly treatment, because one chemotherapy drug can meet their deductible and then they're set for the rest of the year. And then of course, like I said, you have high deductibles with your surgery, radiation, and your new cancer treatments. Multiple lines of therapy puts them at risk for financial toxicity. Even radiation, because you look at something that can be, 5 days a week for 4 to 6 weeks, and you're talking a copay each time you go see the radiation department. So that can be very expensive. And then of course they have long-term follow-up imaging, which is very costly, distance of travel, and then of course housing and food insecurity. So one of the things that I like to kind of keep up with, now this amount hasn't changed since COVID. This was the amount pre-COVID too. So the Federal Reserve report stated that 40% of Americans still find it challenging just to cover a $400 unexpected expense. So I just let you know that people struggle, and some of the zip codes that Mike talked about are a lot of the patients that we actually are helping. So we did a quality improvement project here at our gynecology oncology facility. And that was based on the fact that no one in our region, in this little region here, or even up in Nashville, does financial toxicity screening. There is a screening tool to assess if a patient is financially toxic. We introduced that screening tool into the gynecology oncology group and screened the stage 3 and stage 4 patients for 8 weeks. We managed to literally get care coordination for 100% of the patients that were financially toxic, and coordinating their care and getting them relief for their financial toxicity. And one of the things that we found out when we ran the numbers is that if the gynecology oncology group doesn't screen their their patients for financial toxicity, especially the ones with stage 3 and stage 4, which is the group we studied, they're missing 200 patients that actually had insurance but were financially toxic. And then you look at, we also found that 59% of those patients with stage 3 and stage 4 had financial toxicity. So this kind of correlates with a lot of studies out there too about the amount of people that are experiencing financial toxicity. One of the things that you will be found in research is that financial toxicity, these patients get labeled as non-adherent to treatment. And a lot of times it's not the fact that they don't want the treatment or they didn't show up for your appointment because they don't respect you or something like that. It's because they can't afford their copay. And the other thing about financial toxicity, in multiple studies, they have worsening quality of life and increased mortality rates. And that has to do with the fact because a lot of times they don't follow up or they don't get the standardized treatment because they can't afford it. So one of the things that we do, I wanted to make referral process so simple here. So when you're coming from a facility, let's say like Erlanger Memorial, Park Ridge, or Tennessee Oncology, that that group actually just calls and does a referral and just gives us some basic information. And then we take it from there and screen the patient for our services. Patients can also self-refer. Social workers can refer patients. It doesn't have to be someone, quote unquote, in oncology, but the client that's referred to us must have a diagnosis of cancer and must meet the federal poverty level of 200% and below. And I'll share my screen on that just to kind of show you some of the things that we do after these slides. And then the other thing is that we interview these patients, we see if they are qualified for our services, and then we look for what services they need, what needs do they need, and then we contact them with our social worker if we're needing other issues or other nonprofit organizations, anything to meet the needs and provide wraparound services. This actually is our phone number, and this tells you where we're located at. Our main office, of course, is at Memorial Plaza C. This is our website, ChattanoogaTumorClinic.com. And then that is my email address on the slide. And then this is our CTC team. And I'm just going to do a little quick plug too. We are looking for a social worker, bachelor's prepared social worker. So if y'all know anybody or interested or even new students or whatever, please refer them to me at my email address. I'm happy to have them. But this is what we have. We have myself, of course, Carol and April are our nurse navigators. And then we have a social worker who's trilingual, Eva Miller. And then our front office staff person will be starting soon, who's actually a farm tech, Allie Kirby. So those are my references from some of the stuff that I quoted. So hopefully I kind of got us up on the time. I haven't looked at it. So
you did, thank you, and still provided excellent information. So
I am hoping that I can actually get this off, and then we will. Okay, I got you there. So I'm going to move my camera over.
again, you did a great job. You obviously know the information because you were just talking right along without the PowerPoint moving. So even with the technical snafu, great job.
Yeah, no worries. I wanted to kind of show you guys a couple of things and just talk. I don't know how much time. I guess the next person, I'm a little, 7 minutes over, I kind of caught us up on. But a couple of things I wanted to point out that I know a lot of us do not know, because I'm going to tell you, as a provider for 16 years, you know, we didn't look at insurance. We look, oh, they're uninsured, or they had Medicare, or they had private insurance or Medicaid. But when I started this job, I started studying about the different insurance plans. So a couple of things I was going to share with everyone. I mean, just in our area. So if you kind of look at this here, it's a Medicare book that I have that talks about in Hamilton County, we literally have 36 plans to choose from. So you expect a person who is healthcare illiterate to go online or literally call a number or sign up for insurance. And you practically have to have a PhD to navigate those services. And a lot of times these people that qualify for your market or your Medicare, we have great programs in our community like SHIPS that help us navigate these patients that are unbiased and help you pick the best plan. So that's one program that is needed in a lot of facilities, is a financial navigator or someone who understands insurance that helps their clients and their patients get signed up.
Yeah, I would agree with that. Having that social worker being in this facility really makes, or at the site, makes a big difference. It really does. Well, thank you for presenting. Again, I'm going to ask, just keep us time-wise. We did catch up some. If you have questions, if you would please put those in the chat, and Tina, if you would kind of watch that. And then if, like I said, if we had catch-up time, hopefully our participants will have stayed and we can ask some more questions. So